Microbiology for second year DOTT students 2020. Number 1. Question number 1. Louis Pasteur. Louis Pasteur was born December 27, 1822 and he was died September 28, 1895. He is the one of the French chemistry and also microbiologist who was one of the most important founder of medical microbiology. The germ theory was discovered by him. The germ theory of disease state that many diseases are caused by microorganisms such as bacteria, virus, protozoa, and fungi. These diseases are caused by the growth and replication of microorganisms. The germs theory of disease was devised by Louis Pasteur. He was the first to demonstrate that infectious diseases are caused by microbes. Then his concept of spontaneous generation will take place within the microorganisms. Then Louis Pasteur was developed the process of pasteurization. Developed some of the word first vaccination. Louis Pasteur is the one of the father of germs theory. Louis Pasteur is the most famous for developing the pasteurization process. Louis Pasteur developed the first vaccine means that is rabies. Louis Pasteur helped save the silk industry. Louis Pasteur was copied some of his work. Louis Pasteur is particularly well known for his development of the vaccine for the rabies. Question number 2. Autoclaves. Autoclaves are also known as steam sterilizer and are typically used for healthcare or industrial application. An autoclave is a machine that uses steam under pressure to kill harmful bacteria, virus, fungi, and spores on items that are placed inside a pressure vessels. Sterilization control of autoclave. This is done for determining the efficiency of moist heat sterilization. The spore of Bacillus, then Styrothermophilus are used as a test organism. This is a thermophilic organism with an optimum growth temperature of 55 to 60 degrees Celsius, and its spore required an exposure of 12 minutes at 121 degrees Celsius to be killed. And paper strips are impregnated with 10 raised to 6. Spores are dried at room temperature and placed in paper envelopes. These envelopes are inserted in different parts of the autoclave, and after sterilizing, the strips are inoculated into a suitable culture media and incubated. Correct autoclaving should kill the spores, following which there should be no growth on culture media. Apart from this, there are types of autoclaving, chemical indicators, autoclave types, and thermocapsules. Okay, how to operate autoclave? Sufficient water is put at the bottom of the autoclave over which is placed a performed per- performed tray. Heating is done by gas or electricity. Number 2, the materials to be sterilized is placed on the tray and heating is started. The lid is screwed tight with the discharge tap open. Third one, the safety valve is set to the required pressure. Fourth one, the steam and air mixture is allowed to escape freely till all the air has been displaced. Next one, when no more air bubbles come out, the discharge tap is closed. Next one, the steam pressure rises inside and when it reaches the desired set level, the automatic stem release opens and steam will be escape. Here autoclaving diagram is also there. You have to draw the autoclave diagram and label it properly. When you are operating the autoclave machine, time, stem, temperature and pressure are the four main parameters are required for successful sterilization using an autoclave. The amount of time and temperature required for sterilization depends on the type of materials being autoclaved. Question number 3, acquired immunity. The ability of the immune system to adapt itself to disease and to generate pathogens. Specific immunity is termed as acquired immunity. It is also known as adaptive immunity. An individual acquires the immunity after the birth. Hence, it is called as a acquired immunity. There are two types of acquired immunity. Acquired immunity are active and passive immunity. Active immunity helps in the formation of antibodies and production of immunocompetent cells. Passive immunities transfer immunocompetent cells from one organism to another to increase the resistance against pathogen. Question number 4, type 1 hypersensitivity reactions. Type 1 hypersensitivity is also known as an immediate reaction and involves immunoglobulin E, means IgE, mediated release of antibodies against the soluble antigen. This results in cell degranulation and release of histamine and other inflammatory mediators. Example of hyper type 1 hypersensitivity. Type 1 hypersensitivity includes atopic disease, which are an aggregated IgE mediated immune responses. Means example allergic asthma, rhinitis and conjunctivitis and dermatitis. The allergic disease, which are immune response to foreign organelles, means those are anaphylaxis and angioedema, food and drugs. Type 1 hypersensitivity reactions are there. Here diagram antigen APC and BL active transform into the IgE and IgE fixed to mast cell basophils. Here hypersensitivity reactions with example. One diagram is also there. You have to draw the question number 5. Infection caused by Streptococcus. Streptococcus is a group of bacteria. There are more than 30 types of Streptococcus infection. This Streptococcus bacteria can cause many different types of infections, including skin infection, which are the most common type of Staphylococcus infection. An infection of the blood stem. This can lead to sepsis, a very serious immune response to infection. Bone infections. Endocarditis, an infection of the inner lining of the heart chamber and walls. And food poisoning. Pneumonia, toxic shock syndrome, a life-threatening condition caused by toxins from certain type of bacteria. Causes of Streptococcus infection. Some people carry bacteria on their skin or in the nose, but they do not get an infection. But if they get a cut or wound, the bacteria can enter the body and cause an infection. Bacteria can spread from person to person. They can also spread on object also, such as towel, clothing, odor, handles of athletic equipments and remote. If you have infection and do not handle food properly when you are preparing it, you can also spread bacterial, that staphylococcal infection, to others. Then other, here one image is also there, that is CNS infection, brain abscess, then pulmonary disease, absence of skin infection, osteomyelitis, chronic skin infection, sepsis and endophthalmitis. Means these are the types of streptococcal. Question number 6. Name 3 chemical disinfection. These including alcohol, chlorine and chlorine components, hydrogen peroxide, idiophosphorus, peracetic acid, and phenolize and amino compounds and chemical which are used in chemicals in the hospital used for disinfection. Then there are phenolysis and parasitic acids disinfection used in hospital. Okay, chlorine and chlorine compounds means hydrogen peroxide, parasitic acid, hydrogen peroxide and parasitic acids, ortho pathohalodize and phenolize, then lodophorus. Okay, these are the different types of chemical disinfections are used in the hospital to kill the micro. Question number 7. Universal precaution. Universal precaution means are a standard set of guidelines to prevent the transmission of blood-borne pathogens from exposed to blood and other potentially infectious materials. These activities reviews universal precautions and highlights the role of the interpersonal team in their applications. The main universal precautions are that is hand hygiene, use of personal protective equipments. Personal protective equipments means gloves, mask, eyewears and respiratory hygiene, cough and sharp safety and engineering and work and practice control. Then these are the universal precaution has to be take in the OT. Those are the safety measures for protecting yourself also and patient also and other in the OT teamwork also. Question number 8. Fumigation of operation theatre. Operating theatre fumigation of hospital rooms with high concentration of toxic chemicals has been proposed to reduce the microbial agents on hospital surface and to control surgical site infection. Okay, formalin fumigation has long been an accepted method for areas where the microbiological cleanliness is required. The fumigation procedure is carried out after properly sealing the OT and cleaning the OT and allowing contact materials also, and after fumigation that is contact time of about 12 hours for routine cases and of 24 hours if any gross contamination occurs during operative procedures, means very infectious disease if they have done, means that is HBsIg, HIV patient. Okay, in during such condition they have to do the fumigation. They should not open up to 24 hours. Then you have to label it in the OT door. Then what are the requirements are there for fumigation? Okay, personal protective equipments means PPE set that include face protection also and mask, face shield, gloves, gown and cover all head covers and rubber boots also. Okay, then formalin, you have to take the formalin and 37% distilled water also, and electric boiler, and potassium permanganate is also required, and ammonia is also required. Okay, these are the equipments are required for fumigation. Okay, after fumigation, streptococcus and a group of bacteria, there are more than 30 types of infection you can prevent. Question number 9. Write 3 methods of biomedical waste disposal. There are 4 types of biomedical waste disposal. Number 1, autoclaving, incineration, and chemicals, and also microwaving. These are the 4 types of biomedical waste disposal. Number 1, autoclaving. The process of autoclaving involves steam sterilization instead of incineration, which can be expensive. Autoclaving simply introduces very hot steam for determined amount of time. At the end of the process, microorganisms have been completely destroyed. This process is particularly effective because it costs much less than the other methods and does not present any personal health risk, while some biomedical waste is not able to be disposed of by autoclaving. Around 90% of the materials are sanitized this way before being sent on to the autoclaving. Number 2, incineration. Incineration, this is one of the major benefits of incineration into the health care providers. That easy and simple and quick also. It effectively removes the waste anteriorly and safely remove any microorganisms. However, when burning hazards, materials, emissions can be particularly dangerous. Some waste disposal companions to look towards incineration as their first choice, but materials must be reviewed and determined as safe to burn. Third one, chemicals. When it comes to liquid waste, a common biomedical waste disposal method can be chemical disinfection. Chlorine is a regular choice for this process and is introduced to the liquid waste in order to kill microorganisms and pathogens. Chemicals disposal can also be used for a solid waste, but it is recommended that they be graded first to ensure mixing decontamination liquid waste. Once decontaminated as then disposed into the sewer system. Fourth one is the microwaving. Microwaving, during this process, waste is shredded, mixed with water, and then internally heated to kill microorganisms and other harmful elements. One of the main benefits of this process is the shedding aspects. It lowers the volume of the biomedical waste and it is more energy efficient to use this method than to incinerate, while it cannot be used for all biomedical waste. It can be utilized for a good 90% of it. Just kill autoclaving.